Hi, I'm Dr. Steve Knighton from Nottinghill Family Wellness Center. Today we're going to go over rotator cuff or shoulder injury anatomy. So most people when they get a shoulder injury, they feel pain kind of back in here on the side or around the front. What it is with the rotator cuff, there's 4 muscles. I'll throw the biceps in and call it 5 muscles, but for the rotator cuff, there's actually 3. So the first muscle across the top is your supraspinatus, and it's 85% of the problems you'll have. The second is your infraspinatus, which is below the line here of your shoulder blade, and goes like this. The third muscle we'll deal with here is the Teres Minor, and it just is a little muscle there. Very, very rarely does we see that on any type of ultrasound MRI be injured. And then there's one more on, if you think of her shoulder blade here, it's under her shoulder blade on the front side, and that's your subscapularis. So what happens with the rotator cuff muscle, it's usually from a fall, from sleeping, it could be from nothing at all. One of those or 2 of those muscles get a little bit beat up. The odd time the biceps involved, which is in the front of your arm here, just because there's one head of the bicep that attaches to the front of the shoulder blade. So rotator cuff muscles, there's 4 of them. Usually it's always this one here, it's the supraspinatus. The odd time it's infraspinatus, Teres Minor, and then inside there is your subscapularis.
Okay, so let's recap. The rotator cuff is a group of 4 muscles that sit around the shoulder blade. These muscles facilitate some lifting of the arm and then rotating it in and out. The most common culprit of pain caused by a faulty rotator cuff is the supraspinatus muscle. This muscle sits in the top groove of the shoulder blade and contributes to the first 15 degrees of lifting of the arm away from the body. The infraspinatus sits just underneath it, and its main function is rotating the shoulder outwards. The Teres Minor, shown here in green, also contributes to outward or external rotation of the arm. These 3 muscles lay on top of the shoulder blade. The 4th muscle, the subscapularis, lies underneath it. This muscle is the biggest contributor to rotating the shoulder inwards. When the rotator cuff gets injured, the most common area of complaint is the front of the shoulder. That's because all 4 of these muscles attach to the front of the humerus, our upper arm bone. Pain can radiate down the front or side of the arm, even as far as the forearm in severe cases. Lifting or carrying will be painful. Patients with these injuries may notice some weakness in the affected arm and even experience some pain at rest or at night. Clicking or popping may be felt in and around the shoulder joint, and reaching behind the back, like putting your arm into a jacket, is often difficult. Given that we use our arms and shoulders so often during the day, the rotator cuff has a lot of demand placed on it. Injuries to these muscles can come in a variety of forms. Tendinitis, or the chronic version tendinosis, involve the tendons of any of these muscles as they connect into the bone. The muscles can strain, or in more severe cases, they can tear. We're just discussing the 4 rotator cuff muscles in this video, but there are a number of other conditions that can cause pain in the shoulder, including impingement syndromes, frozen shoulder, or bursitis, just to name a few. These injuries can be the result of a trauma to the shoulder or caused by overusing the shoulder, like throwing athletes or anyone with a physical job. But these injuries can also be degenerative in nature, and in those cases, pain in the rotator cuff may onset for seemingly no reason at all.